Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. My apologies for being a few minutes late. I ran into some traffic issues, but I'm here as well as our guest, Ms. Kathy DuPont. Ms. DuPont is what we consider an expert in her field. Ms. DuPont, tell us a little bit about yourself. Well,
Well,
first of all, our topic today is about maternal mortality in America, more or less. And while it's a beautiful day in Northeast Florida, we still have a distressing subject that kind of clouds the picture as far as it relates to maternal health. I'm not going to discuss fetal mortality, that's for another a different show, but as it relates to maternal health. Ms. DuPont, how are you?
I am wonderful, and thank you so much for having me.
Well, we thank you for coming on board. Tell us a little bit about yourself and whatever you feel comfortable sharing.
Okay, all right. Well, good evening, everyone. I'm so happy to be here. I'm representing the Northeast Florida Healthy Start Coalition. Our CEO is Faye Johnson, and she's been in this space for over 20 plus years, 25, 30 years. She's been in this space, really beating the pavement. So I'm representing our coalition, and I've been working in this field for probably over about 16 years now. And so we've been really working and beating the pavement around maternal health for a while. So I'm just excited to be here. I'm a wife, I'm a mother, I'm a grandmother, and so this topic is near and dear to my heart. My sister had a baby that was premature. My daughter had two children that was premature. So when you talk about maternal health, Black maternal health, it resonates very, very close to my heart.
So, as you can tell from our guest introduction of herself, we're discussing a life and death issue that doesn't matter. I mean, that doesn't get the attention that it deserves. That's maternal mortality, which is the death of a mother during pregnancy, childbirth, or shortly thereafter. So, it's not just at pregnancy and not just at childbirth, but also shortly thereafter. Some have taken that on to be up to approximately a year, what we call a um, uh, perinatal period.
Yes.
um, so now you might think that in a country that got all this technology and hospitals that we have, that this shouldn't be a problem, but it is. Okay.
Right.
And for some communities, especially in the Black and brown communities, the risk is dangerously high. So today, um, uh, an educator, that's what we're going to call you today, an educator will bring us up to speed on exactly what is maternal mortality and what dilemmas that we face as a nation and state and locally, the Northeast Florida region, the dilemmas that we face as it relates to maternal mortality. So tell me, what is maternal mortality? What does it mean if someone says, a mother dies as a result of pregnancy or death? That is maternal mortality by definition. How would you
Yes.
frame it?
Well, you defined it very well. And what I would like to do is just bring just some little context to everything that you just said. And
Gotcha.
so what happens is once the mother she delivers, all of these issues come up behind it. In our communities, and it could be them trying to go back to work if they don't have this time, if you trying to mouth to feed, you got to get back, and so you're getting back your health care, whether it be a Medicaid issue, but you have the post preeclampsia as well, which is the blood pressure issues. You're talking about blood pressure, you're talking about diabetes, you're talking about toxic stress, all of these things, and we have women not only in our communities, but a portion of our community that we kind of forget about a little bit. We have women that are incarcerated as well, that
Wow.
are delivering, and then they're going straight back to population. During that period, you have your heavy bleeding. I don't know if I can say those type of words here or not, but all of these things are contributing to my health. The postpartum depression is a very, very real thing. And if you don't have all of these components of places that can support a woman that has delivered, all of these things play a part in that
Yeah.
in that mortality. And so we're seeing it go up. Our rates have gone up, especially in Northeast Florida, around maternal mortality. And so we've really been trying to really kind of make the noise about it, that even after you deliver, you still some things that you're going to have to do to really pay attention to your health. Don't just say, I have a headache. No, do something about that. Check your blood pressure. Be proactive about some of these things. And you saying something. If it doesn't feel right, you have to say something.
Well, one of the things that we can say, and then I'm gonna bring in Ms. Turner. One of the things that I can say is that the U.S., the U.S. has the highest maternal mortality rate in among developed nations. Um, for instance, in 2021, our mortality rate was approximately 33 per 100,000. Now that is high, and actually from 2020 to 2021, that went up from 23%, 23 per 100, up to 33 per 100 deaths. That's pretty high. And, you see a much, much lower, less than half of that occurs in the United Kingdom and Canada. So what that basically says is that these deaths are often preventable. And that's the most heartbreaking part. It is preventable, as you have discussed, have stated just now, Ms. DuPont. Say something, part of the prevention. Ms. Turner, I'm going to go on ahead and introduce you, allow you to introduce and discuss take this conversation on over, because you're much better at that than I am. I'm too factual sometimes, so go for it.
Well, good afternoon, Dr. Kane, and hopefully I can call you Kathy.
Yes,
Kathy and I
please.
talked earlier a little while ago, so I apologize for being late, but traffic was horrible. Dr. Kane tried to warn me, but I was talking too much. I didn't listen. But anyway, this is a very important topic, and sadly, it gets on the news when somebody popular, famous, or whatever passes. But Dr. Kane, when you were talking about the statistic of 2020 to 2021, the first thing that popped up in my mind was that was during COVID-19.
Right.
And of course, a lot of people were not going in to the doctor. And I can only imagine being an expectant mom having some issues, fearful during that time of going in to see a medical provider because of COVID-19. As a matter of fact, Dr. Kane, it was during that time that my former OBGYN, she retired. And I'm like, oh
Oh,
my goodness, did COVID scare her? When I went back, tried to go back to her once, we were able to start going back in, they said, oh, she's no longer in business. I was like, what? Hopefully, and they said she was okay. But, again, I just wanted to mention that was some trying times. Years ago when I worked at the health department, Kathy, not sure if you know a lot about my history, but I started working with Healthy Start when it started at the health department eons ago. And because I'm a health educator, my role in it was initially teaching parenting education and
Yes.
childbirth education. And I tell you what, a lot of the mothers, the pregnant moms, especially those who were pregnant again after 10 or 15 years, they
Right.
all said, oh, if I only knew then what I know now. Right.
Right.
And also, when we talk about those issues that impact a woman while she's pregnant. Not sure if you or Dr. Kane talked about it, but we
No.
also have to consider the social determinants of health,
Right.
right? Whether or not that expectant mom has a safe place to live, does she have access to care that she doesn't have to drive a long way if she's pregnant and has other little ones and she doesn't have transportation? How is she going to get to her medical appointments? Does she have access to healthy food? Because oftentimes in many communities, people rely on corner stores for their food, and
Right.
or you go through many neighborhoods and all they have, you see rows and rows and rows of fast food restaurants. And
Hmm.
so it's, and Dr. Kane, I was talking to someone, I said, people probably get tired of me, oh, here she goes again, right? And I will go again and again and again until the situations get better. People just don't understand those factors that influence birth outcomes, whether or not a mom has a healthy pregnancy. When I mentioned to one of my colleagues what we're talking about today, she shared after her first, and Kathy, I know this is another conversation, but she shared how she was so depressed and suicidal after she had her baby. She had no idea that
Right.
that was a real thing. She thought that was
Yeah.
just something she was experiencing. And, sometimes moms get embarrassed
Hmm.
mention those feelings that they have, right? And I asked her, did she get help? She said, no, she just kind of, suffered through it, if you will. So when you talk about pregnancy related deaths, we have to consider that when we talk about a pregnancy associated death, is due to complications of the pregnancy itself, the chain of events initiated by the pregnancy that led to death, aggravated aggravation rather of an unrelated condition by the physiologic or pharmacologic effects of the pregnancy that subsequently caused the death. When I was at the health department, and I retired from the Florida Department of Health, but in 1996, the department established a Florida Maternal Mortality Review Committee. And I remember back then thinking, like, wow, do you need something like that? Do you need a special committee to look at what's going on? Are there that many pregnant women dying? I mean, it's just sad. Dr. Kane, I know you're a primary care physician, and this is not really, those are not typically your patients, but still you know about them.
Well, primary care does involve maternal care. It can be, I was trained in obstetrics to a certain degree, not as well as obstetricians, obviously, but I've delivered babies. I've taken care of mothers and babies postpartum, after and perinatally. I've done that. One of the things that what we can say is that you mentioned it earlier, and that is just like we have food deserts, we have maternal care deserts, places where women cannot, pregnant women, and cannot have adequate health care. And that, it's ironic that you say back in 1996, which seems like eons ago, that this
Mhm.
was a problem, that is still a problem. They were
Yeah.
highlighting it back in the early 90s because I remember participating in
Mhm.
discussions
Mhm.
as it
Mhm.
relates to maternal mortality. And back, we were calling maternal fetal mortality. But I remember participating in those kind of discussions. And why are we still facing that today is ridiculous. Now we're going to discuss probably, some of the reasons that does occur. But you wouldn't think that a nation that this rich, these many hospitals, these many physicians per general population
Mhm.
compared to other developed nations would have this kind of concerns or issue as it relates to maternal fetal mortality.
Yeah. And Kathy, I
May,
want
may
to
I
ask
may I
you.
make a comment? May I make a
Sure.
Sure.
comment? It was a couple of things that was said that I would like to comment on. One, since we're talking about some things happened eons ago, so back in the day, after a woman gave birth, you didn't see them for 30 days or so. You would have to stay in the house for 6 weeks. Your
Yeah.
mother, your grandmother, you did nothing. You stayed in the house, you rested. And so it was a reason for that. And I, we think about it now. It's like, I'm not staying in the house for 6 weeks. They didn't want you to wash your hair. You couldn't do anything. And you just stayed there. You stayed in the house. You didn't have the baby out and about. You only went to appointments. So it had to be something very, very important for you to have, come out of that house before those 6 weeks. Well, times have changed. Women don't do that anymore. Some can't. They can't afford to do that. Another point that I would like to make, that I think Dr. Turner mentioned when you were talking about
This Jocelyn. No
Jocelyn. Okay,
doctor.
Jocelyn. One of the things that when you were talking about the appointments and them making the appointments, of being able to go to the appointments, if they have other children and they don't have someone to take care of those children, they cannot take those children to the appointments with them. And so now that's a resource issue. So how about they do have resources that could aid with that? They have programs that could aid with that. But if the person doesn't know about them, so we have to get over these barriers with even connecting with people in the community. Sometimes I don't want people in my business. Well, sometimes people need to be in your business to help move you along, or to let you know of all of these programs and things that are there to help support you. It's not about getting in your business. It's about providing that wraparound support that you need to have a healthier lifestyle. Number three, I want to talk about, I just want to go back to this a little bit. When you talk about food deserts, and it is healthcare, there's no even place for them to even go and get anything. Medical deserts, no primary care physician. We had a young lady that was, she was, working in the field, and she was having a headache. The first thing, and it was somebody was trying to tell her, and I got in their business because someone was trying to tell her, well, just sit down and relax. I said, no, go to the nearest fire station. Those firemen will be more than happy to take your blood pressure. Go there. And so just giving people information so they'll have it, because you don't know what you don't know until you find out you don't know what you did not know.
Break it down. Boy, that was a sermonette right there. If you're just joining us, we're talking about Black maternal health, and joining us is Kathy DuPont. If you're here in Northeast Florida, then you know about the Northeast Florida Healthy Start Coalition. Faye Johnson is executive director, and Faye wants to come on and have a whole show to herself to talk about all the wonderful things. And Kathy is the director of the Make a Difference Leadership Academy. And, I remember, Kathy, when I was, again, affiliated with the health department, I know about the Magnolia Clinic. I remember when they opened, and all the resources that are just there for women. Sadly, though, when you walk around, and it's remarkable that Magnolia has been able to stay open. And this might be higher than your pay grade, so don't comment on it. If you have to, I'm gonna just say it. I'm gonna put it out there, and Dr. Kane will echo me. And I'll say it to Dr. Kane. Dr. Kane, in a time of all of these federal cuts, programs like Magnolia, they rely on federal funds. So I'm concerned, Dr. Kane, that these resources, again, Magnolia has been around. I remember when I was there when the ribbon was cut. When they were open, they have done so many wonderful things and continue to do so many wonderful things. The baby showers and all the great things. I remember when on the inside of the building, Kathy, when the colors were meticulously chosen to make it look very feminine and welcoming to women as they came there. But Dr. Kane, I am concerned about the potential cuts to resources, already places that have limited resources, and for a great program like what the Healthy Start Coalition offers.
Let's look at a couple of facts then. So, just two things. One, Black women are the 3 times more likely to die from pregnancy-related causes than white women. And then Hispanic women, particularly in low-income and undocumented communities, they also experience a higher risk, especially when it has access to prenatal care. And so why we have this gap is systemic racism in healthcare. I you know me, I should call it as I see it. Uh, but Black women, often report their pain being dismissed when they go to the emergency room
Yeah.
or when they go to different places. Even Serena Williams, I never forget the story how she
Mm.
came. I read it in one of my healthcare journals. How Serena Williams, the tennis star, nearly died from childbirth. She was not poor. Okay, she did not. It wasn't that so much that she didn't have access to health care. She was just Black, and she nearly died from after childbirth because nobody listened to her, despite the fact that she was having symptoms of a pulmonary embolism. Okay, which is basically a blood clot in your lungs for those that may not be aware. And uh, it's not so much that I'm a Serena Williams fan, because I am, because of the remarkable things that she's done, but it just highlights the discrepancy in care that Black women have, and how dismissive people have been or are being as to the symptoms that they have during many medical conditions, but especially in this, maternal mortality. It's just systemic racism in healthcare, and it really, really, really is one of those things that we have to somehow overcome. There are other factors why we have this gap, like the chronic stress and racism and poverty that we talked that I kind of just alluded to slightly, but also access to care that we've already said again, and then insurance gaps. Where Medicaid often drop women 60 days after their delivery. They don't give a damn what's going on. 60 days, you've delivered, they get dropped.
Yeah, it's
That is
yeah,
the time period at which heart failure and infections and stuff like that can appear. But I digress. It just kind of pisses me off whenever I see this kind of stuff.
yeah, last week, Kathy, we had a registered dietitian on, and she was talking about, making sure that we eat enough fresh fruits and vegetables.
Yes.
And I know in some of the things that I've been involved in the community, we've been encouraging people to grow their own gardens. We've been encouraging people to start community gardens. So, are you all connected? When you were talking a little bit about resources, are you all connected to Feeding Northeast Florida or Farm Share, or do you all ever connect with them to make sure that those pregnant moms and those mothers or women who already have children, that they at least get are connected to those resources sometimes?
Yes, so we have a great team. There's so many components to the Northeast Florida Healthy Start Coalition. We have our Connect group that they contact the moms and they give them all of the resources. If they tell them they're in need of food, not only will they tell them where they can go, but if they can come by our office, we have things there as well. Sometimes non-perishable things that we can give to them, but we direct them. So it's so many churches now that do the food giveaways that we can help our families get to those places to get the foods that they need. But yeah, the resort is so many programs. But if you don't know, again, you don't know.
You don't
So
know.
that Connect group, whether it's child care assistance, with getting into one of the Early Learning Coalition, the Lutheran Services program, they're giving them the whole list, a gamut of resources, and they can always come back. That's the thing about it. Even if they get into case management with one of the programs or not, they can always come to our office because we're right in the Pearl Plaza. We're strategic where we are. We're literally next door to the WIC office. And we have a great partnership with WIC as well. They send the women over to our office if they need supplies, breastfeeding supplies, support, uh, Pampers, diapers, wipes, things like that. We really try to support moms because these things can be stressors if you don't have those simple supplies like that. Personal
Mhm.
hygiene, a personal hygiene product is very, very important after you've delivered. But if you don't have it,
Yeah,
so
Well,
just
one of
one
the
less thing to worry about, as you said. If
yeah.
a mom knows that she has access, and I like what Healthy Start does. You all have really tried to be creative in your outreach to make sure that you are engaged with the community so that they know while they're pregnant about resources that they may need postpartum. Again, if you're tuning into us, we're talking about Black maternal health. Send us a message. What's your experience? Did you have any issues when you were expecting? And Kathy and I are not physicians, so we'll let you direct that to Dr. Kane, or if there are any other members of the Northeast Florida Medical Society who are listening who could chime in and answer those questions. But ask those questions. And I was sharing with Dr. Kane, Kathy, after talking to my coworker who shared her postpartum experience. I was telling her, I said, man, I was telling Dr. Kane, we might could have a whole show to talk about stories from mothers and the experiences that they had while they were pregnant.
Right.
One of my other former colleagues, I won't call her out just in case she's listening, but I was in a meeting with her last week, and she's pregnant now, and said that, the first 3 months were rough. And and some people, those are the months that are really rough. And the part that we haven't talked about that we need to talk about, and Dr. Kane, I'm picking on you now, so is for the emotional support from the contributors. That's what I call the males.
Oh
Males
my goodness, I was going to say that as
because
well.
they might not be the husband, they might be the boo or boyfriend. So I call them the
Partner.
contributors, um, and the baby makers, the one who helped make that baby, but being there for those expectant moms, because it is a stressful time. Their bodies are changing, they're feeling sick, and so men need to know how important it is to be there and to minimize the stressors that could adversely affect the outcome of the baby. Go ahead, Dr. Kane. I know you want to say something since I threw men under the bus.
Well, it might be rightfully so, to be quite frank with you. It might be quite frank with you. But, one of our listeners did ask the question, are there specific red flags that women should be looking for during pregnancy that might alert us to the higher risk for maternal mortality, which plays a role, truth be told, which plays a role in which those you just mentioned, where those men could help if they pay attention. Blood pressure issues, excessive fatigue. I know, women when they're pregnant, they may be tired, some fatigue to some degree because of anemia. However, if you walk from the kitchen to the bedroom and that's like a 30 to 60-foot walk, and you're out of breath, that might be an early indicator or be an indicator of heart failure. That is one of those components that you see in maternal death, especially postpartum, that you may see and witness to. So men, if you're paying, if you're in the home, hopefully that they're in the home, but sometimes they're not. Anybody that's in the home and witness things of that nature should be paying attention to it. Blood pressures, elevated blood pressures. They should be looking, obviously they should be seeing their at the time that they're pregnant, the primary care provider is OBGYN, obstetricians, not the family practice guy, unless that family practice guy, gal, is delivering babies, performing obstetrics related activity. But and so many the pregnant women do not see a primary care as we traditionally define primary care, i.e. me. Okay, since I don't do obstetrics anymore. However, when a woman is pregnant, her primary care is received through an obstetrician. So an early warning sign for the blood pressure or respiratory rate, excessive swelling in the ankles, that can be indicative of some ongoing problems. One of the things, simple things that we can buy would be a O2, an oxygen pulse oximeter, where you can gauge the woman's oxygen level and help see what's going on with her. Because if she's deficient in oxygen, guess what? That baby is deficient in oxygen as well. So, and then of course the heart rate. How fast is her heart rate? There's a certain You know, you don't expect it to be 140. That's what the baby's heart rate would be, 140, 160. So if a woman's heart rate is 140, 160, you have to start looking at what's going on with her. So there are many signs, multiple signs, as to some pregnancy that might be going awry as far as maternal health is concerned, that we as provide, whether it's the male in the house, many times it's the mother or the grandmother. Let me put it that way. Many times the grandmother, she's paying attention. It's funny how you were talking about in the old days, you know, how much attention they paid to what was going on with that woman. And then these days, you know, they deliver and 4 days later they expect them to be back to work. You know, and not really paying attention to the health of the mother. All they're paying attention is the health of the work. You know, her workload, somebody else, you know, taking over her workload. And so while you have a valid point that men in the house should be paying attention, men that are not in the house, men, period, that are treating women in pregnancy, and when I say treating, I don't mean as a physician, but treating it without concern as to the mother's health. All they're thinking about is putting them back to work. And there's some women bosses out there doing the same thing. We have to, as a society, start paying more attention to what's best for the baby and the mother.
Yeah, there's definitely a need.
The mother is best for the baby.
There's definitely a need for some advocacy. I know, again, I talk about former coworkers, but one of my former coworkers talked about when she lived in Germany, how much time a woman can take after she has a baby before she goes back to work. And she was just so shocked that she said, in America, I can't believe that, you know, a lot of ladies have to go back 6 weeks, some of them, or even sooner. They're being called to go, and some of them are not called if they're hourly workers and they're not paid for time off. They have to go back to work, right?
Yeah.
Again, they got other children sometimes to feed. But
exactly.
May I make a comment as well?
Sure.
So I would like to go back to the fathers. And again, fathers, we do have a fatherhood program under the coalition. It's the Fatherhood Pride program. And one of the reasons why Mr. Jack Johnson, he would beat the pavement about getting services for fathers, because fathers need support as well. And they a lot of times we put a lot of pressure on the man. But again, it goes back to what I said. If you don't know, you just don't know. And so this fatherhood program provides wraparound services and support for fathers. So even if a father came and he needed help with Pampers and wipes, because they need help. Men need help sometimes as well. They need to understand what women are going through, but how can they understand if no one takes the time to give them the information? So in this space, they can come. They have male case managers that provide them parenting. It teach them about how to care for the baby, how to change a diaper, how to put a car seat in. I mean, they do all of these hands-on support services for the fathers. And now they've expanded even more. They have a work coach specialist that help them to be able to find employment. So it's all about support for the fathers. And so anything that a female or woman would get in direct case management, the fathers can get that as well.
Not all fathers are bums, first of all, since you threw them under the bus, Ms. Turner. Not all fathers
I wasn't
are bums.
implying that, Dr. Kane.
I know you wouldn't. I'm just kidding. But many of them are very in tune with the health of their child, and because of the health of their child, they're very in tune with the health of the mother. Because if the mother is unhealthy, especially during pregnancy, then the child may come out unhealthy. They're proud fathers, many of them. We're not talking about Elon Musk, who just want babies, but we're talking about those men.
Some of these words are not coming from me. I
understand that. That's why Dr. Kane says it's Dr. Kane saying this. Okay, you know, if they're gonna come after, let them come after me. And you know, I'm not a male chauvinist, but I do believe in protecting our women. So I'm not gonna throw you guys under the bus like that. It is me that's making this statement. We are, as men, especially a lot of, I'm not going to give a percentage, most, little, whatever, but we as men, black men, we're very concerned about our queens and our children, okay, princess and prince, okay? We're very concerned about them. And so we want to take that role on and do the right things for our kids. You know, even though he's behind the scene, I do look up to my technology guy, Tyrone, because he's been one of those black fathers, even though he may be asleep at the moment. He's been one of those black fathers that participate in his child well-being. And I'm sure if his wife is listening, she may hit him across the head with a baseball bat if he if he doesn't step up and protect the role that, because he has boys, and protect the role that black men play. I would like to go ahead and address one of the questions real quick that one of our listeners asked, and that is it possible that black women thoughts, I guess, contributes to medical staff thinking black women can bear the pain, or are they accustomed to dealing with pain? I guess what they're trying to ask is the role of black women when we're in that boardroom, medical staff, and so on and so on. And there are certain groups of men that are just very dismissive of what women think. Okay, they are wrong for it. Okay, but they are male chauvinists and they're very dismissive. While there are some that really do want to pay attention to what women think and what they need. Now, being concerned about it versus exercising those concerns, putting in place policies and procedures to assist women, and I'm saying women, but men as well, Ms. DuPont, given your point, that are very concerned as to the health and well-being of the child and the mother. So, but there are many of them that just outright biased in terms of how they present how they present women and things that they do. And we just have to get beyond that, and we got to work together. Those men that are concerned, those and the women whom face these dilemmas, we have to work together to try to get beyond those types of people.
Yeah, I also looked at that, Dr. Kane, as do people sometimes think that, and I'm not going to limit it to black women, but black people in general have a higher tolerance for pain. Have you ever heard that when you talk about history?
There's a physician, the so-called father of gynecology, and there's another physician, both white, that came along and made these kind of proposals that that black people, period, are more tolerant of pain, but especially black women. The so-called father of gynecology. I think I block on his name because I hate him so much. The so-called father of gynecology that experimented with black women, doing hysterectomies with no anesthesia. The things that they did to women at that time, and again, it's black women, okay, that they perform those tasks, and they said black folks don't feel pain. Or we have a great, and a lot of these physicians, even to this day, believe that black folks, but especially black women, have a greater tolerance to pain. That's why when you go in the emergency room, first thing they want to do with a lot of black women is give them pain meds. It's like, that's not what I came here for. I came to find out what's going on with me. And you're steady trying to give me pain medication, but I'm trying to figure, and this is not even maternal related, I'm trying to figure out what is the problem, not so much as just giving me pain meds. Other examples, and then I'm going to go back to what our subject matter is sickle cell patients. They're quick to label sickle cell patients as pain-seeking addicts. When in fact, that kind of pain that's associated with sickle cell is immeasurable if you haven't experienced it. So, But
Kathy, I
but
want
I
to
get you
switch
guys
gears.
out the water and let
Yeah,
you go
Kathy, I
back to
want to
your
switch
deep
gears
conversation.
I want to switch gears with you a second and ask, what's your experience working with doulas? Some people often think that doulas are an excellent resource for expectant moms. Do you have any experience working with doula? Are you a doula?
I am not a doula, but we do have a doula program under the coalition as well. We love doulas and we support them. We advocate for doulas and also educate the women that are coming into some of our programs to encourage them to get a doula. It's a partner, a birthing partner. You can have your plan, and that doula will help advocate on your behalf, help you with the communication between the physician and the doctor, and really try to establish a pod that's going to be the best for that pregnant woman, where things that she may not understand or to stand together. So would you explain that a little bit more? She just need a little bit more information. So we are totally in for doulas, and we're so excited about our doula program. They've trained, I believe, maybe about 30 doulas under the coalition now. But the we have a director over that program, Shelby Salter, and she
I
is
know her.
the
We know
contact.
her.
Yeah.
Yes, you know
Yeah,
Man,
Shelby.
Shelby.
I should have Shelby on.
Yes, hell, she's the doula queen with Northeast Florida Healthy Start Coalition.
So also, again, sorry if I keep going back, but I
No,
also want
it's
to
fine.
talk a little bit about what is the coalition doing to help educate females about the importance of taking care of themselves prior to getting pregnant. Do you all have any particular program that focuses on that?
Yes. So interconceptional health, and that's a part of what we've been doing for the last 25, 30 years when hardly anybody was even talking about it. It's been a big focus. Magnolia has always been the program for interconceptional health. And so that program has been around, just like you said, for years and years.
Mhm.
So interconceptional health is a big part of what we do, and so we've been beating the pavement like we've always been out talking to take care of yourself. The better care you take care of you before you get pregnant, then the healthier you'll be during the pregnancy and then afterwards. So we do have trainings that we talk. We have community health workers now that are out in the community. They're literally out in communities knocking on doors, giving out information and talking to women right there in their communities to tell them about just taking better care of yourself, seeing about you, going to the doctor, eating healthier foods, and just taking care of you. So yes, interconceptional health is a huge component of what we're doing.
So let me ask you a question. You may have said it because I was a little tardy. How did
Mhm.
you get into this field? You seem to be very passionate about it. Was it based just on you just had an interest in it? Did you have someone in your life that had issues? What made, how did you get so involved? I can really tell your passion in the work that you're doing.
Okay, so I'm going to call another name that you may be familiar with, and that's Miss Fern Hunter.
Oh, wow.
Uh,
Yeah.
so
I
Miss
heard her.
Fern Hunter, she was my Healthy Start care
Oh, wow.
coordinator when I was pregnant with my son. So I didn't have the services because I was a young mother. I was 16, and I delivered when I was 17, which was I didn't have the support in the hospital by the nurses and things like that. But when I had my son, I became a part of the Healthy Start program. She was my care coordinator at the time. She provided all of the support services, parenting, breastfeeding classes,
Fern's
birth
great.
education. But the thing about it is, what else she did, was concerned about me as a person. I at the time I hadn't even finished college at all. She encouraged me to go back to school, and she was like,
Mhm.
"You can do it." Literally,
That's
she
fun.
did, and
Yep.
I did. I decided, I was like, okay, I can do it. She was just so encouraging that made me fall in love with just this entire concept because of the things that she did for me. She followed me on through. I remember when she retired, and at the time I hadn't gotten my master's, and she would, you need to go back and get your master's. And I know it was full circle for her after I uh, got my degree, and then this position came open. And I was shared this story today because I was at a meeting, and Miss Faye Johnson, who is the CEO of Northeast Florida Healthy Start Coalition, we met when we were in college. I had no idea who she was, but we was taking some college courses together, and she said she just watched me, and she said I was real mean back then. But she saw something in me, and the first position that I was able to get in the social services field was at the Azalea Project. So I provided care coordination services for pregnant and newly delivered women who had a history or currently was using substance abuse. So we would help them get into gateway treatment facility. But yes, so I do have a passion, and then my family. My sister had a premature baby. My daughter had 2 premature babies. I understand the capacity of young women pregnant. She was working so hard because she wanted to do the grind, make sure she was working, but she really did not take the time to rest and like she should have. And so she went into labor early.
Well,
So
the one
yes.
thing I try to tell patients, period, is it's kind of like when you go on an airplane flight. Um, the first when those stewardess or stewards are asking you to give you information, pre-flight information. The one thing that they always say when that oxygen mask drop, the first thing you do is put it on yourself. So those mothers need to make sure they take care of themselves in
Yes.
order to be able to take care of their babies. Quick question. One of the listeners asked, are doulas covered by insurance? I don't have an answer for that.
I have an answer. Yes, I'm so excited. So it is through Sunshine Health. Yes, so if they have that one, and so the coalition is really trying to encourage. So hopefully more Medicaid insurances will come on board. Some private insurances as well. They can bill for private insurance for doula services as well. And then some doulas, they really have a passion and a love for it. If they contact some of them, and they'll work with them if they have to pay out of pocket as well. But yes, they some of the Medicaid providers they can bill Medicaid for the services.
And I have to make a plug and say, to our listeners, please start advocating for things. Advocate for doulas, advocate for community health workers. They're both such a vital part of the medical team, not just for maternal care, but for primary care, all throughout the healthcare system. Advocate the next time there's an election, tell those aspiring elected officials to make sure that community health workers, doulas, and other people who are part of the medical team, that their services are billable, that they can bill Medicaid, they can bill health insurance and things, so that those services will be readily available throughout, and not just for individuals who can only afford to pay
Right.
for those extra services. One question that I don't remember that we talked about, again, I'm going eons back because I worked for Healthy Start in the golden days.
Okay.
But they used to do 2 screenings. They used to do a screening for the pregnant mom, and then once the baby comes, and that assessment determined what resources the mother needed. Is the assessment still done? It was just across the state of Florida where a pregnant woman, no matter where she went in, that assessment was done on her and would link her to the Healthy Start case manager or care coordinator. Is that still the way it works, Kathy?
So it still works similarly to that once they go into their first appointment with their intake paperwork. And this is the thing about it. Sometimes they are not aware because they're filling out so many papers, but that screen is with that intake paperwork. And so our staff follows up with all of the OBGYN doctors' offices in Duval County, or surrounding counties as well, Northeast Florida, Baker, Clay, Duval, Nassau, and St. John's. Follow up with all of them, and they get those screens. They come back to our Connect staff. The Connect staff contacts them. They get a phone call. If they can't get them on the phone, they send a letter. But they are trying to make contact with that pregnant woman to connect them with services. They tell them about all of the services that they qualify for as a result of them completing that screen. Once the baby is born, that screen is automatically generated, and then the staff receives that as well. So even if the mom did not get services during the pregnancy, she can still get those services through the baby after the baby is born.
Yeah, it looks like we can have. When you were talking, I was thinking of Beverly Butler. I'm like, isn't that what
Beverly
Beverly
Butler
did?
is over the program.
I know, that's what I said. I'm like, I think that's what Beverly does.
That's
But
what she does.
there's so many of you that I know, and I
Yes.
didn't know you before today, Kathy. But there's so many folks, Shelby, Beverly, of course, Faye, Marcia, that
Yes.
are over the programs. Jack, over
Yes.
the programs at the
He's
Healthy
recently
Start
retired.
Coalition. And we didn't talk, by the way, today, we didn't talk about opioid use. That's another element to the things that influence birth outcomes.
Right.
Again, that's another whole topic that we can get into that. But
And you
I
can
know
kind of
through
skip over the opioid and go straight to the THC, the marijuana. That is a huge driver right now, and it's an issue as well. But yes, ma'am, go ahead. I'm sorry.
No, go ahead. That you're
Yeah,
saying
because
something that I
that's
didn't
not
know.
as that
So,
given the laws that have been implemented since Ms. Turner was back in the health department, that is a huge concern. So elaborate on that further.
no, it's just because it's so accessible. It's like the thing to do now. To marijuana is the thing, and so a lot of women, mothers, are not thinking, I just smoked a little marijuana, is not going to affect anything, when it does. Marijuana affects the fetus. Tobacco, as well as tobacco, affects the fetus as well. So we have all these. You talk about alcohol, the syndrome, you have that, and opioids, and we put a concentration on those, the crack babies and things like that, but we don't put a focus on tobacco. We don't put a focus on marijuana, when those are the things that's really accessible and very, very popular, and it is affecting our baby, the birth outcomes as well.
It's
Vaping,
funny.
those are the businesses that are in. I was looking here on Dunn Avenue, and there's a vaping store that's
Yes.
about to open. I was like, as though we need another one. Sorry, I'm not bashing the vaping industry. I'm just saying, unfortunately, people are influenced by those things and don't think about making those lifestyle changes while they're pregnant. Go ahead, Dr. Kane. Were you going to say
I was going to
something?
say, even if you look beyond, because the problem with marijuana is that a lot of studies, the drug really hadn't been studied that much for obvious reasons. They were, there's a whole lot of reasons they were not studying it. But one of the things that using marijuana, and I'm not going to attest to the actual pharmacological effects as it relates to the child, as much as it is the behavior of the mother that's using it while they're pregnant, and they may be more dismissive of some things than they would if they were not high. I mean, I guess that's kind of the way to explain it. That I'd be looking at it and trying to make sure that they be alerted that, because some of them going to give you that argument, hey, look, it's not going to hurt the baby, yada, yada, yada. But it may hurt the mama's thinking, which secondarily then affects the baby, if that makes any
Right.
sense.
Mm-hmm.
Well, this was a very, very engaging conversation, Kathy. It was wonderful meeting you. Now I know another member of the Northeast Florida Healthy Star Coalition team.
Yes.
Well, I hope Faye is listening, because I want her to sit. I just want her to know she has a really good team of folks working with her. Again, I felt your passion. At the end of every podcast, we like to give our guests an opportunity to share their final thoughts. What are your final thoughts regarding tonight's topic?
So it's a great topic, and I'm so glad that we're talking about it. It's affecting women and men in our community. I don't want to over look our fathers as well. My thought is that the only way that we're going to really affect change is if we change the way we approach things to say that we are the answer. And I talk to my group every time I do a leadership group. I always tell them, let's stop saying that we don't know. Let's find out. Let's be more assertive. We need to find out who the shakers are, the people that are in the positions, and stop thinking that we don't have the right to call and find out who your city council person is. If it's a problem, how are they going to be aware of it if you don't talk about it to the persons that need to know and can help do something about it? And so knowing who these people are and why is it a desert in certain areas, what are these things going on? Let's walk around with our eyes open and not walk around with them closed anymore. So yes, when you see it and it looks like it's bad, it is. And we should say something about it. So knowing that we are the answer, and we have to, this is how we're going to affect change in our community, is by us reaching out and educating and providing that information and saying, hey, it's okay to have support. These loads of programs that's out there, and that's what they are designed for. Don't get distrayed by when you saying, oh, somebody's trying to get, no, the program is for you, and it's a way to advocate for yourself if you're not getting the services that you need.
Amen. What's the main number to the Healthy Start Coalition? Do you have that memorized? Because I used to, but I don't anymore.
Okay, so I just
We're
had
going to move on to Dr. Kane, and then you can come back and we'll look it up. So,
okay, I'll get it.
Dr. Kane, what are your final thoughts regarding tonight's topic?
Well, there's a couple of things. One that she just elaborated on. First of all, thank you, Ms. DuPont, for coming on and helping us get a better and clearer understanding of what's going on with maternal death, bringing awareness of the maternal mortality, i.e. maternal death, again, associated with pregnancy by definition. The one thing you did just mention is that, educating, saying something is one of the key factors, but not just with your congressman and local city council people or anybody else along that line, but also as it relates to something that you guys said earlier that was mentioned in our conversation by listeners. And that is if that a lot of men are trying to justify their behavior because it's because of their incompetency and or inadequacy in terms of lack of taking care of these patients. So I just, for those women who happen to be in a position, whether it's a mother or a grandmother of the women or friends, and you see something that's not right, say something about it to assist that mother, because there's no, at that stage in their pregnancy, I'm not sure what may be going on at the time, but it may be things that if they're not pregnant, they can clearly think about. But they can use the assistance and advocation of those people that are close to them. I want to say a couple of quick things. The CDC has, given a list of the key causes of maternal mortality, i.e. maternal death, death during pregnancy. Number one is cardiovascular disease. So before you get pregnant, know what your cardiovascular status is. Okay. Number two, hemorrhage. You're bleeding during or after pregnancy. Don't take that lightly if you're spotting and just say, oh, it's a little spotting, and be dismissive of it. Make sure we find out, meaning physicians and caregivers, find out why you may be having that spotting. Infection or sepsis, sometimes a UTI, urinary tract infection, or some other causes of infections can play a significant role in terms of fetal death, but also of maternal death. Blood clots, we mentioned earlier, high blood pressure. Oh, that's a big concern, especially in Black women. And of course, you guys mentioned earlier, mental health and substance use disorders. So when you look at all of these, of course, overdose and drug overdose and that kind of stuff is an issue. But when you look at these things, think about it, whether it's you, your sister, in some cases, might be your mom that's pregnant, or your friend. Think about it. Help. Reach out and help them, whether you're a man or a woman. Reach out and help that individual that may need help, but because of the stressors of pregnancy, may not be thinking as clearly as they can when they're not pregnant. And it's not being dismissed. I'm not trying to be dismissive of what women go through during pregnancy. I'm just trying to make sure that by any means necessary, we need to help these mothers survive that pregnancy. Thank you.
Thank you, Dr. Kane. And Kathy, did you find the number?
I do have the number. So our community programs office is at 5316 North Pearl Street. And the number there is 904-801-3350. And our main office number is 904-723-5422.
Do me a favor, repeat those, please.
Yes. The address is 5316 North Pearl Street. And it's in the Pearl Plaza. The phone number is 904-801-3350. And our main office number, the Healthy Start Coalition main office number is 904-723-5422.
Thank you. Thank you so much, Kathy. And as we close today's conversation, let's remember that Black maternal health is not just a medical issue. It's a human rights issue. The disparities that we've discussed are not coincidences. They are symptoms of deeply rooted systemic inequities. But with awareness, advocacy, and action, change is possible. To every mother, birthing person, and family impacted by these injustices, we see you, we hear you, and we stand with you. To our healthcare providers and allies, this is your call to do better, to listen, to learn, and to lead with empathy and accountability. The path forward begins with each of us. Let's continue to demand better systems of care and build a future where every Black mother and baby not only survives, but thrives. Thank you for joining us on Pause for the Truth. Until next time, stay informed, stay engaged, and most importantly, stay empowered. Good evening.
And stay on, Mr. DuPont.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.